All right, thank you so much, Daniel. Well, according to the CDC, mental and physical health are equally important components of our overall health. But due to a number of factors, including social stigma, mental health is often put on the back burner. Well, during this Mental Health Awareness Month, advocates are continuing to shine a light on this topic as it's often left in the dark. Now, one of those advocates, somebody I like to call a mental health warrior, is the executive director of NAMI Mid-Carolina, Zenithia Brown. Z, thank you so much for joining us this morning.
Thank you for having me again. Thank you so much.
Yes. Okay, so first up, we got to talk about NAMI so people understand what it is and how important it is for our community.
Yes. We are NAMI Mid-Carolina, and we are the local affiliate for the National Alliance on Mental Illness. So not everyone knows what NAMI stands for, but we are the largest grassroots mental health organization in the country.
Wow.
And NAMI Mid-Carolina serves the Midlands. We are the grassroots part of the organization, and we provide support groups, education, and outreach to the community as a whole.
Yes, and it's so important to note that all of it is done for free.
All of it, yes.
Free, that is so huge.
Yes, cost should not be a prohibitive measure for any person seeking mental health services.
Absolutely. Now, one of the things that I want to do is have a conversation about some of the different mental health struggles that people may have, starting with depression. I mean, we have some really startling numbers about the number of people. We actually have a graphic. It shows that depression is more than just feeling sad, and 7% of U.S. adults had at least one depressive episode last year.
Exactly. And that's actually down from COVID. You know, right now we talk about 1 in 5 people experiencing a mental health condition. During COVID, it was 1 in 3.
Wow.
And so there are still people that are still coming out of that. And, you know, again, like you were saying, depression is not just a feeling of sadness or feeling down. It is a physical weight that people feel. You know, when I tell people, you know, if you want to imagine it, take a backpack and put some bricks or some bowling balls in it and just walk around and try to do your daily activities. It is that heavy. And, you know, we ask people a lot of times, you know, what do you have to be depressed about? And sometimes it's nothing. Sometimes it's just that your mind tells you, you know what, this is not a good day for you. And this is not a day for you to do your activities, and you can't help it. And we need to stop trying to, you know, shame people for feeling like they can't do anything that they are feeling depressed, because it's not something that they can control all the time.
I love that you said that. We have to stop shaming people. So what as a community can we do to lift this social stigma? How can we help?
You know, I know it sounds so silly, but, you know, have the conversations. I was talking to a friend of mine, and we were getting ready to plan a Bridgerton watch party. But you know what? I thought about it. What difference is it to call your friends together and have a, you know, a mental health meal? It doesn't have to be something heavy. You know, on a scale of 1 to 5, how do you like your job? Some people are going to say 5. Some people are going to say 0. You know, but have those conversations, and it does not have to go deep. But it's that starting point.
Right.
You know, to be able to let your friends know that you are a safe space. Let's have the conversations. If you can't have these conversations anywhere else, let's have them here among ourselves.
Absolutely. And also too, I think one of the biggest things is getting help when you need it.
Exactly.
There are so many resources available. Can you talk to that?
There are so many resources. Of course, we've got 988. You know, if you have a friend or someone's in crisis, definitely call 988. The South Carolina Department of Mental Health has what they call their mobile crisis center, or their mobile crisis unit. They come out, they evaluate people that are going through crisis, and so that, you know, you have that choice between hospitalization or incarceration. You know, they're able to come out and do the mental health assessment. And I will say, probably the last 3 weeks, I've gotten so many phone calls from people needing housing.
Yeah.
And that is something that is very underfunded in our state. And I would love for, you know, NAMI is a nonpartisan organization, but as we always say, mental health is always on the ballot.
Absolutely.
So we need to know where our elected officials stand.
Absolutely. Z, thank you so much. And my friends, you can still give
Yes.
to NAMI. We also have all of those links to the resources that Z just talked about too on our website, WLTX.com. You can see that right there. But if mental health is a cause that you want to support, NAMI Mid-Carolina is a great organization to give to.
Thank you
really
so
quick,
much.
that website.
NAMIcanhelp.org.
There you go.